The same thing with drug and alcohol relapse. Let's say that you're in recovery and you have the thought, gee, I want to use. Instead of shaming yourself that you should go and use, or that you even have that thought, non-judgmentally looking at that thought and saying, wow, something triggered a craving for cocaine or marijuana or alcohol. Wow, that's interesting. And to acknowledge it at arm's length is that that's a thought. And I have the choice of either acting on that thought or not acting on that thought. Sometimes we do stupid things. Why do we do stupid things? Because we're not mindful of what's going on. There's an AA statement, shit happens. But there's also a sense that people sometimes invoke the screw it attitude. You know you're doing something that's not mindful or appropriate. Maybe it's drug alcohol use. Maybe you're going to cheat on a relationship. Maybe you're going to do something that's unethical. Maybe you're going to do something that's illegal. The ability to look at that thought and why it's happening and recognize it and say, that's a thought. How many of you have been in a city and you think about stepping off the curb, or you're in your car and you begin to back up? And something happens. You need the last second, you turn around and you look, and sure enough, you step on the brake and you prevent an accident from occurring because there was somebody right behind you. The mind is pretty amazing. What made you, at the last second, take that extra look? So, oh, gee, man, I almost got rear-ended backing out of that spot. It's mindfulness. That quick last-second thought that you paid attention to. The same thing on daily living. The ability to be present and say, wow, this is a thought. That's an attractive person. I think I want to have an affair. Wait a second. What's going on? Oh, I don't think I'll go to class today. Or I don't think I'll go to work today. Or I think I'll get stoned before a big meeting. That's a thought. You don't have to act on it. Think back in your life in situations where you were that close to doing something that would have caused self-damage. But the last second, you looked at it as a thought and said, no, that's probably not a good idea. So mindfulness is about being present in the moment, not judging your thoughts, but instead recognizing, oh, it's interesting that I have this thought. Do I act on it? Do I not act on it? So the application of mindfulness really means being totally present at a high awareness level, a high focus, a flow state, in a zone. At the same time, you're in this high arousal state and you're also relaxed. You can smile to yourself. In my counseling sessions, frequently I'll be with a client, and both at the same time, the client and I will have this aha moment. This awareness that, aha, so that's what it is, a discovery moment. And to be able to look at that discovery moment and say, oh, so that's what it is. Oh, to smile at that, to recognize that, to be relaxed with it. When you talk with people, how many times do you really focus, really listen, really present? Or do you think about where you want to go, or it's a little, you're not engaged, or your attention isn't there? So mindfulness in relationship and intimacy is about full attention with relaxation. It's not a high energy kind of manic thing. Just as I'm talking to you right now, I'm in a high energy state and I'm trying to relax and slow down and be present in the moment. Some of the things you can do from listening to this tape is, with some people that you know, or the next time you're in a conversation, make eye contact. Slow down. Give yourself 100% focus in terms of listening to someone else. Breathe. Take in a deep breath. Inhale, hold it for a few seconds. Slowly let it out. Stay focused on the conversation. Notice how intimacy and connection occur when you're mindful. Try it out. Come back. We'll talk more about mindfulness.